A patient arrives to the ER in a comatose state. He is shallowly breathing, appears disheveled, and has pinpoint pupils. There are track marks on his right arm and it appears swollen. Which of the following conditions does this patient likely have? A. Opiate overdose. B. Benzodiazepine overdose. C. Alcohol overdose. D. Aspirin overdose. E. Anticholinergic overdose. The answer is A. Opiate overdose. This patient likely has opiate, heroin, overdose. Common signs of overdose include altered mental states, decreased respiratory rate and effort, and pinpoint pupils. Treatment includes inhalation of naltrexone to remove the opioids off their receptors in the body. Additionally, track marks are a sign that the patient injects heroin. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. If the organism identified in this patient's urine sample is Proteus mirabilis, which of the following would be the appropriate treatment? A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. B. A 14-day course of ampicillin or cephalexin. C. A 21-day course of ampicillin or cephalexin. D. A 10 to 21-day course of oral quinolone or trimethoprim, sulfamethoxazole. The answer is A. A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. The first-line treatment for uncomplicated urinary tract infection with Proteus mirabilis is a 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. 10 to 21-day courses are only appropriate in patients with complicated UTI or co-infections. Ampicillin and cephalexin are poor choices for initial treatment due to a 10 to 20% rate of resistance in Proteus species. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On urinalysis the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. This individual is most likely experiencing a urinary tract infection, UTI, due to which of the following organisms? A. Proteus mirabilis. B. Staphylococcus aureus. C. Escherichia coli. D. Staphylococcus saprophyticus. The answer is A. Proteus mirabilis. While all of the organisms listed are capable of causing UTIs, Staphylococcus species are all gram-positive. Escherichia coli, while responsible for 75 to 95% of all UTIs, would not result in a urinary pH of 9.5. The high alkalinity of this patient's urine suggests a urea-splitting bacteria such as Proteus. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. In the case of chronic Proteus mirabilis infection, which of the following is a common sequelae? A. Pelvic inflammatory disease, PID. B. Bladder cancer. C. Renal calculi. D. Infertility. The answer is C. Renal calculi. Due to its production of ureus, Prochus mirabilis infection results in alkalinization of urine, as ureus hydrolyzes urea to produce ammonia. This can cause the formation of calcium, struvite, or apatite crystals in the urine, which may form renal calculi. P. Mirabilis is not associated with increased risk for infertility, PID, or bladder cancer. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumotrax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. Pneumotrax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness.